based on international reporting standards, the numbers we have reported, which to date is 16, is subject to lab tests and confirmation. But I do take the point that I saw in a media house today that those international standards don't necessarily reflect the reality on the ground. And we believe it is important to reflect those realities and the challenges, and therefore we are reporting the suspected cases based on the doctor's assessment and the need to tackle the problem at the community level, which is why we have taken the approach to give these numbers and not just the 16. 2 of the 16 confirmed positives are pregnant women who will be continuously monitored, and samples were tested both at the University Hospital and CARFA labs in Trinidad. All confirmed cases of the Zika virus have fully recovered, of the 16. As you know, the unborn child is at high risk of developing microcephaly once the woman has been infected with Zika virus while pregnant. As part of the second phase of our activities, we'll be placing more emphasis on pregnant women, their partners, and those who develop severe diseases such as GBS, while we continue to engage the population and stress the importance of taking personal responsibility. Let us be frank and let us appreciate that fogging is an extremely temporary solution. The most permanent solution is people action in their community to prevent the larvae from breeding into a mosquito by controlling breeding sites. We have tested through the public health inspectors a number of sites around the country over the last number of months and found that up to 75% of the breeding sites are drums that are deliberately set for water for use for domestic purposes. In other words, we could significantly reduce the risk of these mosquitoes being in and around or in our presence, and therefore representing a clear and present danger to us, by just taking some time to monitor those sites. From our standpoint, we are going to try to ensure that drums used for storing water are tightly covered with plastic or mesh. And in this regard, we want to seed that initiative. It's about changing behavior. Again, through the charitable services of Food for the Poor, we have had dialogue with them. We are in the process of ordering some 50,000 drum covers. It's a mesh that would secure water in those drums. We may need a couple 100,000. We're going to start with 50,000, again through the services of Food for the Poor. Hopefully that will be here in short order. But we're also going to be dialoguing with local manufacturers to see to what extent we can encourage the production of this particular item and making it available in the hardware stores and so on for persons to go and acquire on their own as part of that initiative. Ensure that your open drums that are used to collect water are treated. That's another approach. And there are some home remedies that we have to get back to and recommend usage of. I am told that if you put 3 drops of cooking oil in the water and it creates a sheet on top of the water, it doesn't compromise the quality of the water. It can be still used for domestic purposes. But what it does, it prevents the larvae from escaping and therefore reduces the risk of greater breeding and by extension the risk of the mosquito biting us.